what I wanted to do was tie together a couple of earlier themes of the conference with healthcare technology, and also the effect that those technologies, ways in which those technologies have been affected post-COVID. And in the United States, and I suspect in Korea as well, the existence of various lockdowns has accelerated the utilization of patient-reported outcome digital health by probably a decade. And so that's what we're going to try and work through now. Let's see here and share. Right? Yeah. Okay. So with luck, everybody can see this this title that was just given, Making Pain Optional. And the main point of this will be using a technology and combining it with big data and automated machine learning. So why migraine? It's the most common chronic disease in the world. There's 40 million people in the US, 1 billion worldwide, and at least 5 million people in China. 1 out of every 4 women who's zoomed into this presentation is likely to have experienced migraine at one time or another. It's a poorly managed disease because there's low information at diagnosis, and that diagnosis, the treatment depends on the quality of diagnosis. The single most important thing is just counting the number of incidents per month. For decades, neurologists have asked patients to keep track of diaries, and about 5% of people do that well, probably higher in Korea, but pretty dismal in the United States. So being able to use real-time smartphone diagnostic data will see dramatically improves diagnosis and treatment. And so those data points, when you get enough data for an individual patient, and you can do this at the level of n equals 1. So one's ability to use an algorithm to diagnose pristine would be different than the diagnosis that you would do to diagnose my admin, Stephanie, who's here helping me. So even though there are millions of people, you don't have to coordinate the data for millions of people. You just have to coordinate it for one person at a time. And so what we're doing is using a migraine mitigation platform, basically a smartphone application. You can download this from your favorite site, either Google Play or the App Store. And we'll just show you quickly what it does. It's deployed a bunch of places. There's multiple patents that associate with it. It's won international awards. But basically, the idea is really simple. You're having a headache, you pull up the app, you touch it once, it notes that you're getting a headache, you tell it what your symptoms are and what medication you're taking. That all takes about 12 seconds. And because it takes essentially no time, patients turn out to be very compliant with this. Once you've got that information can be put directly from the cloud into the patient's electronic medical record. That allows the doctor to go into that medical record, see what information the patient has introduced, and then build a specific care platform for the patient based on those specific data. So what difference does it make that it's really easy to use? Normal apps, including medical apps, you lose 80% of the users in the first week. In this, 90 days later, you still have 80% of the users, and that means 80% of the patients, we have a chance to provide better data for the doctor and therefore better care for the patient. And how does that work? It turns out that just getting that little bit of data allows the physician to change the prescriptions for the patients, with the result that in multiple studies, we found that the total number of headache days was reduced by 45% for people that used MigraineX for 3 months, which was long enough for the doctor to get reliable data. And so you've got all that. Now, what do you do with that? As we started getting more and more data for patients, we started to realize that there were trends that were showing up for these patients. That, for example, living in North Carolina, occasionally hurricanes would come through. And every time a hurricane would come through, we would see huge spikes in headaches, which suggested that there were weather-related events that were affecting these headaches. For users who are willing to turn on their GPS, then we know where you are, and if we know where you are, we can predict the weather ahead of time. So if you have weather-related onset of headaches, we can start to predict when you'll have headaches. And different people have headaches at different times of day. Different people have headaches on different days. There are some people that, like clockwork, have a headache Tuesday morning. Turns out very few people have headaches on Saturdays. You can draw your own conclusions from that. So armed with those data, for each individual where we have multiple headaches, we start to create a training set. And we put that training set through a neural network, and then we refine a personalized machine learning algorithm to predict migraines for each individual. For some individuals, we don't have any idea what causes your headache. And maybe it's something you ate and we have no information about that. But for many patients, the combination of sleep data, menstrual status, weather data, and temporal data allows us to predict the headaches before they occur with a positive predictive value. And for those of you who know much about statistics, I'll simply say that's the most stringent version of prediction. It's much more stringent than simple accuracy. So using a positive prediction value of greater than 90% in people that have headaches frequently. If you only have one headache a month, you're probably not terribly worried about predicting it. You just take some Advil and on you go. So that allows us to start thinking about, as care providers, a third way of treating headaches. The most traditional way is acute treatment. You get a headache, you think, oh my goodness, I better go take some medication. But by that time, you've already got a headache and it's pretty unpleasant. And it will take an hour or two before that medication kicks in and starts to help resolve your headache. So if you get a lot of headaches, a physician can take the data from MigraineX or some other source of data that tells how many headaches you're having a month. And if you're having more than 8 or so, they are likely to put you on a preventative treatment where you take some kind of medication chronically to try and prevent those headaches. And there are a variety of new medications that have been developed over just the past few years that provide effective preventive treatment. The downside of those is you're taking them not only on the days that you need them, but also on every other day because you don't know when a headache will strike. So there's a third option that's been made possible by the kind of technology that I'm referring to, which is a preemptive treatment. If you knew 24 hours ahead of time when you were likely to have a headache, you only take the treatment 24 hours ahead of time, and then you never get the headache at all. That's what we're currently trying to understand how well that might work. I'll simply say there's pretty good reasons to believe that this preemptive therapy will work, especially with a class of drugs called Japans, which are uh, a very recent, just approved in the U.S. within the last year, and early treatment with that medication results in pain-free rates that are much higher than otherwise. And for some time, many physicians for women who have premenstrual headaches have prescribed a triptan to be taken the day before your period starts, and we know that helps prevent onset. So I'm going to skip that. So what I really want to show you then is some data, and this is real world data for several hundred patients where we had 30 or more migraines to predict their behavior, to predict their onset, and then we start looking at migraines that haven't happened yet. So it's a retrospective analysis, and you'll see how that works. I'll simply note that this is all protected by patents, which sounds kind of funny for software, but we're not patenting the software, we're patenting the algorithm, our ability to predict and our demonstration that you can predict. And so here's kind of the last thing I want to show, which is for about 30% of the patients, we can predict your headache before it happens 90% of the time. And that means that instead of taking medication every day, so if you have 8 headaches a month, instead of taking 30 pills, you can take 8 pills. And since these pills are actually kind of expensive, being able to do this only when you need it is advantageous, and it minimizes all the side effects of these medications as well. So sort of the bottom line of what I've told you is 3 things. First, you can use smartphone technology to improve migraine care, and a big thing that COVID changed, in the United States at least, was the Center for Medicaid and Medicare Services put in a new charging algorithm that says if a patient can't come in, but they can just provide into your electronic medical record something like their migraine records from their smartphone, then you can review those records without seeing the patient at all, change their medication based on that review, and the important thing, if you're the doctor, is you get paid for doing that. So it's not a lot, but it allows the doctor to actually make money doing something that they'd like to do anyway. It allows them to save an enormous amount of time. It allows the patient to save an enormous amount of trouble. And then when she and the doctor get together, they can actually talk about improving your care instead of asking you a bunch of dumb questions that you won't remember the answers to anyway. So it dramatically improves patient satisfaction with the patient-provider relationship, which is something that gladdens the hearts of all physicians. So that's thing 1. Thing 2 was the reimbursement, and thing 3 is that once you have those kinds of data, you can start to do something that seems rather magical, but in retrospect is actually pretty straightforward. If you have enough data, you can combine those data with a neural network to predict things ahead of time. I would suggest that this approach will not only work for migraine and the 5 million Koreans that have to deal with this on an ongoing basis, it will probably work for many, many chronic diseases that present episodically. So it's likely to work just as well for IBS or for chronic or for episodic flares of rheumatoid arthritis, or for any of these chronic diseases that depend on external conditions to trigger things. So that's basically the story I wanted to tell. I think I got that done in 30 minutes or less. So I'd be happy to take questions. And in the slides, there are specific references that you can go to get more information. And thank you for allowing me to participate in this first virtual forum. It's been an amazing, I was able to look at some of the other presentations. I think it's been an amazing experience. The only downside for me is it kept me from visiting Korea this year. So thank you.